Hello and good morning, everybody. What's going on? It's Mike here in the Raleigh office. I hope you're doing great. I've got Isaac, my teammate, our agent support master here on this training video with me today. And Isaac is really excited to join you today because he wanted to introduce everybody to some really cool technology that you have access to as a TMG partner. So, Isaac, man, how you doing, buddy? You excited about this?
Man, doing great. Absolutely. Yeah, this is quite frankly, Mike, I feel that this is really this tool has a lot of opportunity and potential. It's really been untapped to this point. We definitely want to make sure that our agent partners are taking advantage of all the resources that they have here at Tidewater being a partner. But what we're about to go over today, I think, is really going to highlight some tools and technology and data that really sets us apart from the crowd. You know, this isn't something that you can purchase on the street or gain access to with a partnership outside of Integrity. This is something that's going to be unique to an Integrity partnership, and it has a ton of value. So I'm excited to be able to go through it, be able to show everyone how it works and some of the really cool data points that we can pull to be able to make sure that we're focusing our marketing efforts as effectively and efficiently as possible to make your dollars work as well for you as possible to then grow your business quickly and maybe get some new business in states that you might not necessarily be working in currently.
That's awesome, man. Well, Isaac, you hit the nail on the head, man. Like we're outside of AEP now, right? AEP, we're all accustomed to be, crazy busy. We're trying to see as many people as we can. And then first quarter hits, second quarter hits, third quarter hits, and it's where can we find opportunity, right? And for those that are spending money on marketing, whether it's digital or direct mail, it's sometimes it can be really difficult to know like where to target, where to hyper target, right? I like to call it bullseye marketing on a digital landscape because it's nice to know where the opportunity is almost down to a local community within a zip code. So whatever, man. Hey, look, we could talk about this forever, but Isaac, man, show us what you got. How do our partners get to this information and how do you use it? What is it?
Yeah. Great questions, Mike, and I appreciate you leading that direction. So what we're talking about today is going to be a tool found within the CSG app inside your Medicare Center platform. So first and foremost, if you don't already use Medicare Center, reach out to one of us and we can certainly show you how to be able to use this incredible piece of technology. But to be able to gain access to what we're going to discuss today, you have to be registered there first. So first and foremost, if you're not there already, make sure that you go to MedicareCenter.com and click register, sign up with your NPN so that you have access to it. So then you can get to the page that we're looking at here and then continue to use these tools. Keep in mind, folks, everything that we're showing you today, including the Medicare Center, is absolutely free of charge for any agent partner with Tidewater. You still get paid full commissions for any business that's written through here. The access that you have here is phenomenal. And quite frankly, it's hard to put a dollar figure on the amount of information that you have because carriers and providers use the information that we have access to for free, but they have to pay large sums of money to be able to gain that data so that they can make decisions on either expanding to new markets or adjusting their existing plan footprint to make sure that it maximizes benefits and keeps them competitive. So we get industry insight that we don't have to pay for. I'm going to probably hammer that home all day today, but it's that I can't express how important that is, that you can have access to the data that people are clawing and fighting to be able to get access to if you know the right person.
Hey, Isaac, let me ask you a question, buddy. So you talk about cost of this technology you're about to share everybody. So let's say I am an agency owner.
Sure.
And I have hierarchy. Say I got 100 agents on my team.
Good for you.
Do I, as an agency owner, need to cover the cost for all of my agents to get access to this technology?
And great question. And absolutely, they do not have to cover any costs. Again, this is going to be free to use for any partner, whether it's an agency level with 100 downlines or sub agencies, or if you're a single producer. Everyone that has a partnership with Tidewater with at least one Medicare Advantage contract has access to the system. And so I guess I should make that point. If you don't have a Medicare contract with Tidewater, you will not have access to Medicare Center, which will not give you access to this tool, the CSG app that we want to talk about. So
Awesome.
If you don't have any Medicare Advantage carriers, you don't have access to it currently, but we'd love to be able to walk you through the process and how you could be able to grow your business in that market if you would like. But for most of our folks who have at least one contract, anyone that has at least one contract with us will have access to this, again, free of charge. Great question.
Awesome, man. Show us how it works, man. What
Sure.
you got?
So once we're in the Medicare Center, you're registered, active, ready to roll. It's going to be on the CSG app. Is where we're going to find the tool. Now you'll see this loading bar, and because there's a lot of data we're about to access, you want to make sure that you have a strong internet connection. And even still, sometimes you have to reload to be able to go back in. It's just one of those things that we kind of have to manipulate a little bit. But again, it's because it's accessing so much data from different locations. It can take some time to be able to use this tool. It's not an error. It's not an issue. Just be patient. What you'll see here is a dashboard that looks fairly similar to the desktop version of Tidewater's mobile quoting tool. However, you'll notice that there are a bunch more options. You have several more options to be able to take advantage of. And one of those options is what we're discussing today, and that is that MarketEdge run search function. This is where we can actually find raw data, and I'll show you what that data looks like here in just a second, that you can manipulate either using pivot tables and an Excel spreadsheet to basically uncover a lot of opportunity. And I'll show you kind of how to look at the data to find some opportunity there as well. So once we're in CSG via the Medicare Center, which will look like this, you're going to go ahead and click run search. If for whatever reason, when you're in here, you'll notice that, let's say that Tidewater pulls up in this corner, log out, try the process again. It should then show you in Medicare Center or one of the other ones there, but you want to be in the Medicare Center version of the CSG app. So again, if you use it somewhere else, sometimes it can change those accounts. It's a quick just button here to make sure, again, you're in Medicare Center first to find it. And we're going to click run search. This allows you to look at anywhere from a state level down to, like Mike alluded to, a partial zip code to find data such as annual average income for those households, how many people are turning 65 in the next 30 days in that area, how many Medicare supplement quotes are run in that area over the last 30 days, as well as how many people are currently on a Medicare Advantage or Medicare supplement plan. So a little bit of math here, I can show you how we can figure out how many potential clients are in a specific area that we can target. So the first thing that we're going to want to do is obviously select the state that you want to look at. And again, you can look at any state in the country, not just states that you're licensed in currently. And that's where we're talking about potentially finding business opportunities in states that you may not currently work in. We're going to look at North Carolina for this example. And you can dive down to specific just 3-digit zip codes. So for like Raleigh, we're 27615. So a 3-digit zip code for us would be 276. So it's every 276 subcategory is all kind of grouped into one. Or you can dive down specifically into just a single zip code. But I recommend looking at the state first and then zooming in to make sure that you don't miss out on any of that data. As well as the quote parameters, we can narrow it down to a specific supplement plan. Again, I like to see every supplement being quoted when we're looking at that. And then you can narrow it down again by either tobacco use, age if you want, and gender. Again, I'm an equal opportunity kind of guy. I wouldn't filter out any of those options unless you're really targeting a specific subset of people. But listen, whether they smoke, they're tobacco users or not, male or female, age, if it's business opportunity, it's a business opportunity in my opinion. So I wouldn't filter that out so that you can get access to as much data as possible. And again, you can then see your quote date range. It'll always pre-populate to the last 30 days. And the numbers that we're about to see are based off of any quote run through CSG, whether it's an insurance agent, a carrier, someone off the street that's using it to run Medicare supplement quotes. Anyone that's using CSG nationally to run quotes, that data is shown here. And so we're going to go ahead and click run search. Like I said, this can take a little bit of time to be able to load some of these screens. Again, we're looking at a lot of data that it pulls for these specific areas. So just a little bit of patience can go a long way here. But I can tell you folks, every time I'm in this system, I find a new method or opportunity that's uncovered to be able to get really creative and specific on how you want to target folks.
Look at all the red on that heat map.
That's right. Exactly right. This is what a heat map looks like. And again, the tool that you see now is something that carriers pay a very pretty penny to get access to. Again, free of charge for any of our agent partners. It's an unreal advantage compared to a lot of the competition, and no one else in the country, unless you're an integrity partner, gets access to that. And so again, everyone at Tidewater is obviously an integrity partner. So you have this at free of charge. So what you'll see here is the heat map. Basically, the darker the color indicates the higher volume in quotes. And so you can hover over, let me get rid of that. You can hover over specific areas and it'll pop up. Like we discussed, the 3-digit zip codes show up first. So again, when I said, we're 275 area, which is basically surrounding the Raleigh metro, what we can see here in that 275 zip code, that there have been 1,888 Med Supp quotes run in the last 30 days from anyone using CSG. What we can also see here is that the population of over 65 individuals is roughly 178,000 individuals. We can also see that there's over 1,000 folks that are aging into Medicare in the next 30 days. That's 1,000 opportunities minimum for just T65. And then, like I said, we can look at the Med Supp policyholder count as well as the Medicare Advantage enrollment count. So some quick math, what we can look at here is roughly 152,000 folks that are over 65 have either a Med Supp or Medicare Advantage plan. But if you subtract that from the overall population plus another 1,000 that are getting added in the next 30 days because they're aging into Medicare, we're looking at roughly 28,000 people in that area that don't have either a supplement or an MAPD plan. So we know that there are 28,000 seniors that are more than likely either on a group plan, which is probably a very small percentage, or just on original A and B. Wow. So instead of targeting the entire state, we know we can target specifically there. Now, when we're targeting specifically there, do we want to target high income individuals, low income individuals, or do we just kind of want to do a cookie cutter method? Well, with this tool, we can actually dive down and separate how we want to spend our costs to target a region like the 275 zip, but then in that subcategory, target a population that are higher income earners towards Medicare supplements, as well as low income earners, either Medicare Advantage or possibly even DSNPs. So instead of just saying Medicare supplement leads, trying to pay for it in this area, we can say, well, I want Med Supp leads in these specific regions, but I want MA leads in these specific regions, so that you'll be targeting the folks that are more apt to purchase that type of product instead of just sending them something generic. So again, we're talking about being more efficient and being much more precise with the targeted marketing to specifically what those clients need. It should hopefully generate a lot more opportunity for you. From here, you can either view details and it'll kind of break down what you can see above. I'm going to go ahead and close that quickly though, but I'll show you if you want to zoom into a specific region. So of that 275, what we can see is that subcategory broken out by specific zip codes. So we can see which region it has the highest number of quotes, as well as now once we're in the subset, we can see the median household income per region. So we can see here, when I hover over this, I can see the median household income of 55,000 roughly. Okay, that's kind of middle of the road. We can either look at both supplements or Medicare Advantage. But as we scroll over to the 27713, we see that median household income is up to 68,000. We might want to just lean towards supplements first in that area, not necessarily low income individuals. And if we look around, we can see the 27704, that median household income has dropped down to 41,000. We would more than likely want to target that area, that exact zip code, with specifically just Medicare Advantage.
Man,
and again,
this training you're providing, it reminds me so much of how much this industry has changed and how much integrity has changed the industry as an insurtech company. I mean, less than 5 years ago, we were throwing spaghetti against the wall in markets trying to find where the opportunity is. And now it doesn't matter whether you're running Facebook ads or YouTube videos, or you're doing local seminars or direct mail. This technology here is telling me that I'm looking at this specific area and I'm looking at these red areas, right? Mm-hmm. Well, before, if you're doing direct mail, you're just mailing Raleigh, right?
Right.
Well, now you're like, nah, you know what? There's certain areas of Raleigh that I want to focus on.
Exactly right.
That's a game changer, man. That is, it's going to help. It's going to help our agent and agency partners, know where to market to where that opportunity is.
Exactly.
This just wasn't available in the past.
No,
and cool.
Like I said, it's not available to anyone else still other than an integrity partner. This information is just not something that's offered in the public or even within the insurance industry, quite frankly. I mean, this is a game changer. There's no other way to put it. This gives you, as a agent partner of Tidewater, such a leg up and an advantage at no cost to you. It's hard to put in words just how much value that this type of system brings.
And man, and the thing that you hit on, Isaac, and I'm really happy that you're going really in depth and zooming in here, is it's so hyper local, right?
That's right.
I'm thinking if you're, if you're an agency owner, or maybe you're an agent that sells over the phone, I mean, you don't have to worry about just, blanketing an entire state and seeing what sticks. Like, you can hyper focus your targeting and your marketing here.
That's right.
It's really cool stuff, man. Great job on explaining how this works.
So Mike, and just to key off on that, so I was just kind of working my cursor over some of these surrounding areas, and I noticed here in this specific zip code, 27565, I see a medium household income of 42,000 roughly. There's only been 29 Med Supp quotes. And that kind of makes sense because of that income level. Probably not as many, but what I see is a huge marker. There are 6,000 people that are over 65. There are another 37 that are aging in the next 30 days. Of those, we're looking at roughly 5,000 have coverage already, either Medicare Advantage or Med Supp. That's telling me that there's almost 1,000 people in that one zip code that have original Medicare. That's 1,000 people in a single zip code that you can target.
You got my wheel spinning, man.
Right. Well, now, okay, let's try this on for size. When you're using this information, we know that there are 37 people turning 65 in the next 30 days. Well, I feel like we have another quoting tool that we could use in unison with this, called our T65 locator, where we can actually get addresses for folks in that area that we can target. Names, addresses, and ages, right? So that we can either use the pre-built marketing letters that we use that in unison with the T65 campaign that's available for free on our VIP portal to target those folks. Or you could even look at getting on some grassroots and door knocking, not Medicare Advantage, but door knocking other products to be able to start meeting these clients face to face. So,
Isaac, hold on a second. You're telling me that I could log in today to this MarketEdge, find out where the opportunities are based on these color coding methods. Then I could also use another piece of technology, which I guess we'll cover in a different training, but I can get the name and address of those people and their birth date in that area.
Exactly right. That's exactly right. Yes.
That's incredible.
Exactly right. It really is absolutely incredible. So really, to expound on that, what I'm saying is today, if you get into this, you could be this afternoon knocking on some doors, talking to people that would be Medicare eligible, but offering different products to start communicating with these folks. We can see where we can see where those opportunities are, right? So it's not something that's going to take a week or a month to start getting leads back. This is something that you could start doing today and making an impact on your business.
All right. So Isaac, I'm an agent, I'm an agency owner, and I'm a little limited on funds right now because I just spent a ton of money on fourth quarter.
Yeah.
Maybe I just paid a tax bill, right? So I'm a little,
if not, you're
limited on my marketing, right?
That's right. Yep.
So you're telling me that with this technology, I'm going to get this data, and really it's just sweat equity. I don't
sweat equity. That's right. Exactly right. A little bit of sweat equity. And again, even if your funds are depleted at this point, there are very low cost methods of being able to market. As well as I do, Mike, Facebook marketing, digital marketing can have a very low cost financially. Like you said, there is sweat equity involved, a little bit of creativity, sure. But instead of sitting around and trying to figure out where am I going to generate leads or get in front of new people, that doesn't cost a lot. We have methods here that you can use to be able to do so. Again, whether it's mailers, just sending birthday cards, even using some of the other tools that we have, and entertaining these people. But you, again, will know where you want to target, and you will already have a good idea, a fairly good idea at least, based on their median household income, of what type of products that you would want to be able to present to them if they ever arose a need. So it gives you some really kind of insider trading when you're talking to these people, because you already have a very good picture of what they may be capable of purchasing or what they're interested in. Now, keep in mind, you should always go into an appointment with your blinders on. It's not for you to make a determination on what they can or cannot afford. But we know, because of premiums for like supplements, for instance, someone with median household income of 42,000, they might be on that line. But again, it's not your job as an agent to be able to make that determination. It's your job to educate the client and to offer products to them. The client is the one that's going to be making a decision of purchasing. So just because you may be going into a lower income area doesn't mean that you just leave the Med Supps at home, for instance. You may want to lead with the Medicare Advantage, but don't ever leave something off the table like that. Because if you're not going to offer it, I can guarantee you there will be an agent behind you that will just present it. And whether they want to purchase it or not, if you didn't give that option to a member, that can leave a real bad taste in their mouth, right? Like, okay, they didn't even tell me that they could do this. I don't know that they can do this. The worst feeling in the world is spending time building a relationship, getting an enrollment to only find out you end up losing it to someone else only because you didn't offer a product. Whether they want it or not, you didn't give them that opportunity to make the choice. You made the choice for them. So always keep that in mind, that you want to be the educator, you want to be the advocate, and you want to be able to offer products and then inform the client so that they can make the best educated decision themselves.
Yeah, man. I'm Isaac. You again, man. Great job. I look at this and, man, I'm a huge fan of digital marketing. I'm looking at these heat maps, and not only am I going to use that T65 locator, but I'm going to be running $1 a day brand awareness ads in these areas that are red hot, right? $1 a day brand awareness ads, right? Because according to the data you're telling me, there's a lot of opportunity with people that are not on an MA or a Med Supp plan.
That's right.
So when I say brand awareness, I'm talking about targeting people that are 65 and older in these zip codes that Isaac just hyper targeted, and providing education, brand awareness education ads, like those work. And previously it was, especially with Facebook ads, it was throwing spaghetti on the wall in every market we could and seeing what stuck. Well, now we have this data.
Right.
Data is king.
Yes.
Data is king when it comes to marketing. So really cool stuff, man. Sorry, keep rolling, man. You got
So just while you're talking, Mike, I was kind of toggling over to the western portion of the state, and what I noticed in this region here, so the 287, I see that there were 1,500 quotes from the last 30 days. That's a lot of activity, right? What I can also see is that there's a population of 138,000 eligible seniors. Of that population, again, with some quick math, we're looking at 111,000 of them are already on a plan. We're talking, 30,000, maybe 20, let's say 20,000, and just to lowball it, 20,000 eligible seniors that aren't on a plan right now. That I would spend money and time and effort marketing that area, whether it's brand awareness or if you're trying to set up educational events to get in front of folks that would be interested in that. There's a big population of people that more than likely would be interested in being able to hear what you have to say, or to, like I said, either an educational or sales meeting. Those would be places I target to try and drive people to those locations, right? So it's not just necessarily trying to get someone in the door for an application right away, but if you can use this to then merge it with whatever your existing business strategies are, what you prefer to do to be able to generate leads. So again, that portion of lead generation is going to be more efficient for you and more effective because you're being so precise with how you're targeting folks. So again, like Mike said, with throwing spaghetti against the wall to see what fits or sticks rather, this way you can in a very purposeful manner target areas where people would best receive what you have to offer.
So let me ask you a question, Isaac. So, I'm an agent. This technology is amazing. It's all good. But, one thing that we highly encourage folks to look at is before you get into an area and you market an area, make sure that you're appointed with the competitive carriers in that area. Is there some feature within this MarketEdge that says, okay, if I want to market in 27613, which is a zip code in Raleigh, is it going to show me saying, hey, you know what, in this zip code, here are the competitive carriers, right? So this way I'm prepared. So I don't go into a home. I'm doing all this targeting. I can go into a home and, Lumico is number one. I don't have Lumico, and then I got to get contracted. And now I'm behind the curve instead of ahead of the curve. So is there anything like that that's, that can give us that data in here?
That's a great question. And the answer is yes. Absolutely.
Cool.
Yes. And now, and I just want to keep in mind, we will come back. I do want to show as well how to be able to extract the raw data from this system, because there's going to be some more things that we can do there. So we'll get back to that, but great question, Mike. And I will show you what we can do there. Cool. On the left-hand side, you have a competitive comparison option. And again, you have to be a little patient with the tool. We're dealing with a lot of raw data here to be able to receive this. And this is up to date daily through CSG. And then some of the information also comes through Deft Research, which is also an integrity partner. They're really the two kings when it comes to actual data analysis that's provided to both carriers, providers, as well as even hospital systems, things like that, when they need to look at stuff. So what we want to do, and I apologize, I actually need to run a new quote to do so. There we go. So what I did is when I'm running a comparison, I hit the top to see rate comparisons. Again, going to select North Carolina.
You know, I noticed, Isaac, we're both wearing integrity swag today as well.
We really want to talk about branding. Integrity does a wonderful job branding.
For the record, Isaac and I did not coordinate that.
We did not today. That's right. So what we can do is, again, we can dive down to a specific state or region. We're going to look at the state as well as the effective date for the specific supplement. And now it's key to make sure that you use effective date that you want to write, because this system will pull the active rates based on the effective date. So if there's a rate change and you select today's date, and let's say there's a rate change 4/1, your data won't be accurate to what you're actually offering the client. So make sure if you're running in an area and want to offer 4/1 effectives or 5/1 effectives, make sure you're running that based off of the effective date selected here. I'm going to do a 4/1 effective. I want to run a plan G because that's the most popular plan. You can apply a household discount if you'd like. Let's do that, actually. You can include demographics, include select plans if you'd like, but now we can select carriers. And I'm going to do LIPS, which is the Lumico product specifically, seeing we were talking about that. So I'm going to select all to compare versus our primary.
Wait, so what you're doing, Isaac, is you're singling out a LIPS to see how it compares to every other carrier in that zip code.
That's right. And now, and the last key point of metrics that you want to look at is how does it compare against the entire population of or available carriers in that area. So we want to look at it. So set the dollar amount range you would like to compare your primary company's lowest rate against all of the carriers' lowest rates. So
this is really cool if you're a Medicare supplement producer that has a book of business in a certain zip code. It'll allow you to look at what your clients are currently paying compared to what's available. Right?
That's right.
And
That's right.
It'll allow you to make those calls, say, hey, you know what? I might be able to save you a couple $100 a year if you just switch your plan G to a different carrier. Right. So
exactly right.
That's really cool, man. So it takes a lot of that homework off the agent to give that data. That's awesome.
And now keep in mind, we all get notices of rate changes. So even if you have an existing book of business and you're notified that XYZ carrier is getting a 6 or 7% rate increase next month, well, we know your population or book of business is looking at may want to look at other options, but that means everybody else that's written with that carrier also has clients that may be interested in looking at lower rates. So automatically you should know, okay, well, if my book of business is getting a rate increase for that plan, everyone else is too. So you can not only target your folks, but target folks that may be on that plan already to say, hey, you may have just received a rate increase. Would you be interested in looking at alternative options to lower those costs? So again, you're not just reaching out to the Medicare supplement population as a whole, but we're going to be targeting folks specifically that may have just received that rate increase. So again, we're going to be working smarter and more efficiently in everything that we're doing. So you can see here that in this map, based on the household discount, the Lumico Ellipse product is the lowest cost plan in all of these regions. with the household discount included. Without the household discount included, I believe this map is green across the board for OLIP specifically. But we're looking in some of these other areas and we can see that the premium difference is $1.20 from the lowest plan. We're talking $1.20 a month. That's a rounding error when it comes to these scenarios. I can't tell you how many times I've talked with an agent who's dealing with a client that they don't care if the big name company, whether it's the Aetna, Humana, United Healthcare, Blue Cross, whatever it may be, they want that name brand compared to that. So they're willing to pay a little bit more for that. It's our responsibility as agents and educators to, again, educate our clients to explain the risk reward to doing something like that, and also how that applies to maybe some of these smaller carriers. Now, if you have a bunch of unhealthy people that you need to put, we always recommend putting them with a large carrier so that they can absorb that bad business so that it doesn't affect the rates across the board. Because everything that you do as an agent directly affects your clients and the health of that book of business. So with these lower or these smaller companies, we certainly want to look at offering healthier clients to that product versus the unhealthy to ensure that that pool stays healthy while still servicing the clients that you have. And so that helps everybody, both your partner agents as well as yourself and your clients. So you really are directly responsible to a point of affecting those rates and those rate changes. So by being a little strategic with what you offer, you can, again, keep those rates low to the best of your ability as an individual. But again, we can see here in these regions, we're talking $1.20 difference from the lowest product out there. So if I'm offering Ellipse, I know I'm coming in with, if not the top plan, it's within $1.20 of the lowest cost that could be offered to that client. So before you even get in the vehicle or pick up the phone to speak with this individual, this potential client, you already know what you have in your book or what you have in your toolkit is going to hit their concerns if all they're concerned about is the low premiums. And a lot of cases with Medicare supplements, everyone, because a plan G is a plan G is a plan G, they're really looking about they're looking for the rates and stability. So this will allow you to be able to target those. And again, you can change the parameters to either the dollar amounts can vary if you want as well, but this is really cool to see how you stack up. And like Mike alluded earlier, the worst feeling in the world is sitting down with a client and not having what you need to write the business in hand right there. Either having to go back, contract, wait for that whole process, and then hope that the client either hasn't gone somewhere else or is kind of zoned out at that point or is uninterested. You know, if you have a sale on the table, it's always best to be able to capture that business at the time of the initial appointment and versus having to come back. Because as we see, the more interactions, the more time that's delayed between your initial encounter where they say yes to when that business is actually written, the lower the closing rate is. Mm-hmm. So again, to keep your closing rate as high as possible, you want to make sure you have the tools available to you to be able to handle those clients. So this is where you can do some research prior to just figure out where the competitive products are, which products that you offer are competitive, or maybe I need to look at offering some of these other carriers that are really hot and competitive in a specific state. And keep in mind, if you're working in multiple states, obviously the carriers may vary greatly or might be the same. But again, so that you can be competitive and so that you can be most efficient in enrolling folks, have everything done ahead of time. And especially this time of year, we're not in AEP. It can be a little bit slower. This is really the time to do these admin things and building up your business to have the tools available so that when you're ready to pull the trigger and write business and start doing production on a larger scale, you have what you need and you're not stalling out to wait for a carrier to onboard you. Mm-hmm. Especially during the fourth quarter, we all know everything gets bottlenecked and slowed down. So we don't want you to be out there on a limb, not being able to capture a piece of business that you either spent money on, time, energy, and effort to either miss out on or have to wait and slow your process down. We want you to hit the ground running and to continue moving forward at a good clip, not being slowed down by some unnecessary things that we can now overcome prior to those scenarios. So again, another useful portion of this tool. And again, you can save these searches if you like. They're also exportable where you can pull them off into a PDF. Mike, anything else that you have questions about when it comes to the rate comparison or portion of this?
Looks awesome, man.
Okay. The last thing I do want to show while you have me here is how we can actually extract this raw data and then kind of discuss a couple different methods that we can manipulate that data so it works best for us. So I'm going to go back to MarketEdge to the very beginning to run a quote. We're going to go back to the state of North Carolina.
While you're running that quote, Isaac, so for TMG partners, if you're watching this, and it's a lot of information, it's a lot of data, and it's why we wanted to record this video. But if you need help, if you're looking at a certain area and you need help finding which carriers are competitive, and we're big on looking at these carriers that offer bonuses, right? Because like Ronnie James says, eat your bonus because you never know when you're going to get it again, right? So looking at some of these carriers like Humana and Lumico Ellipse, these carriers are not only competitive for your clients, but they're competitive for your business, right? So look at those bonuses, look at these carriers, make sure it's always the right fit for your client, no matter what. But you know what? If there's a carrier offering $100 per app bonus, use that. Use that to pay for your Facebook ads. Use that to help cover the cost of your seminars. So if you need help with those carriers, because look, we're independent. There's a ton of carriers that we offer. It can get overwhelming at times. Just reach out. You see it scrolling on the bottom of the screen, 888-622-9122. Call Isaac, myself, whoever, here in the office. We'll be able to help you through it. So, but go ahead, buddy.
That's right.
Sorry,
and this is recorded. However, we are about to step into our second quarter. Keep an eye out for some updates. We're going to have some Q2 bonuses coming through with some of our Medicare supplement carriers. A couple that I've been told, I've yet to see, but I've been told are extremely rich for the agent. So you're able to offer a quality product at a low cost to the client and take advantage of what I've been told is one of, if not the largest per app bonus offered for a specific carrier. And so you'll see that coming very soon. Again, like Mike said, if you have any questions, reach out to us and we can explain which carriers are offering what. But there's a lot of bonus incentives for agents with some of our Medicare supplement carriers that I would appreciate every agent being able to take advantage of, because it's good for you, it's good for us. And I would hate to find out that you had potential business there that you sat on, only because you were unaware that there's a window of time to be able to write that business to gain those incentives. Also, keep in mind that with our supplements, some of our core supplements that we look at, they're incentivized very well for our top producer trip. We're about to go on our 2022, I guess, top producer trip. Is that what we're branding it there? With a bunch of amazing agents. We would love to see even more next year. And a great way to be able to do that is targeting supplements. It's a 0.5 point for any supplement offered by Tidewater written, but it's a point for some of our core supplements that we're really kind of incentivizing. By using this system, it's pretty easy to see that you could figure out a game plan to be able to hit that 100 app count, which is what you would need to qualify as an individual producer to be able to be on our top producer trip next year and maybe hanging out with us. So just keep that in mind. So the last thing I wanted to show you, Mike, before we go, again, I appreciate you spending time with us this morning and giving me the opportunity to be able to show folks this amazing tool, is being able to extract the raw data. So first, once you've run that quote for a specific state, what you can do is you'll see these functions here. You can either look at a bar chart, but I like this table. What this is going to show is a breakdown of the population enrolled in supplements based on carrier and underwriting type. So you can see how many people are on an existing book of business for any product out there. So like I mentioned earlier, when we said we may have just run into a carrier or two that had a rate increase either in March or April or May, whatever it is, you can see how many people are on that product. So it gives you an idea of the total count of how many folks would be interested potentially in at least talking about looking at other options to lower their costs.
Wow. Good stuff.
So it's building the table now. Again, it's be patient with the system. It's pulling a lot of data. And again, we'd rather be accurate and correct versus quick and inaccurate. So here we can see a breakdown of every single plan that's offered in the state, and then a subcategory of how many individuals are covered based on plan type, as well as the rate class. So you can see how many people are, we'll say, on a standard AARP plan for the invite-only agents, actually. Or if someone's on a standard or a multi-insured coverage, or people that are on the standard 2 product, which is the kind of the downgraded rates, higher rate class for those folks. So you know that they have at least one health condition that disqualified them from a full underwritten app. So these people are probably going to be less healthy and more than likely aren't going to be the best use of your time to target, only because they probably can't get through underwriting. But if they've gone through a rate increase, it might be time to look at a Medicare Advantage as an option instead for those folks. But we can see the total population enrolled in each. So it gives you an idea how many people are potentially out there that you could target to roll business, or move business rather, from a carrier that just received a rate increase to something that might be more competitive in the market. And this can be manipulated with a bunch of different ways to adjust the table so that you can kind of see that information. But what I really like, I'm going to go back to the original display, which is that little wavy map, is the export function. And that's where we can pull all this raw data. You can either pull it into an image, but what I really like is being able to pull it's a CSV file. It's an Excel spreadsheet file. And that'll pull all the raw data that is used to create these heat maps. And this is what I was talking about at the beginning of this discussion about using the raw data to manipulate it to be most efficient, whether you're using a pivot table or just filtering so that you can get a really good image or view of the opportunity there. So let me save this.
Good stuff.
I'm going to move it here. We can see that on our screen. So what we can see now in raw form is every 3-digit zip code as well as every 5-digit zip code. And we can very quickly filter just through Excel. So let's say if we want to filter smallest to largest. So it kind of throws everything in there. So we can see that the total number of quotes for 270 would be 629 quotes in the last month. What we can also see is of the 3-digit zip code, we can get down into the 5-digit zip code. So we can see that in that exact 270007, there's been 188 quotes run. There are 615 people that are over 65 in that area with a median household income of $46,000. And then lastly, we can see the enforced Med Supps and MA enrollments. So right there, we see that of that population, a heavy percentage is MA versus Med Supp. But with some quick math, and again, if you're proficient at all with Excel, you can create a quick equation to basically capture this data and find where there's the biggest discrepancy. Basically, if you add the enforced Med Supp and enforced MA and subtract that number from the total number of people that are over 65 in that area, it'll quickly show you how many eligible seniors don't have a product already. Mm-hmm. And so by adding that equation into this spreadsheet, you can very quickly identify which regions have the most number of people that are not currently on a product. So that, again, if you have a limited resources, even if you have a lot of resources, you can use those resources effectively and target groups where it's going to produce the most opportunity for you. So instead of throwing spaghetti against the wall to see what sticks, you are very targeted and very precise in where you're trying to find those areas. And we've had a couple agents that actually brought some of this to our attention that last fall were writing in a state that they're not domiciled in. Now, they work in quite a few states in our call center, but we noticed that they were writing a ton of Medicare supplements in some random Midwest state that they've never written business for. And I think, Mike, you were actually the one that had the conversation with them and asked them, hey, guys, how did you even find this opportunity? Why are you writing business there? How did you know that it was there? And they're like, Mike, we've used this heat map to see there's a high concentration of quotes in this specific area for the state. And we spent all our resources and aggressively targeted those areas to hit them. And it bore a lot of fruit. They were very successful in writing a ton of new business in an area they'd never worked without ever having to step foot there, while still servicing their client base.
Man, I'm looking at two, so this is great with Med Supps because, like you said, man, a plan G is a plan G, and the consumer behavior is people want the biggest bang for their buck, right?
Yeah.
But I'm looking, so say if I don't sell Medicare supplements, say I'm just a Medicare Advantage agent, I'm looking at this as well. I'm looking at areas that have heavy penetration rates with MA. Yep. And I'm running some brand awareness ads about dental plans or about hospital indemnity because these folks are on MA, and according to Def Research, what they launched last quarter, one of the top reasons why seniors are searching for other MA plans is for dental benefits. Well, now that Medico has a brand new dental plan that's actually worth something. Ronnie James said he never believed in dental plans before until Medico, you you could create some opportunity in these areas where it's heavy MA penetration and sell some dental plans and sell some hospital indemnity plans. And
Cancer,
as you
heart
know,
attack, stroke. Oh yeah.
yeah. And as you
Yep.
know, folks, like with MA, if they're not in your book of business, you can't market to them, right? Well, if you go in and you sell them a dental plan or a hospital indemnity during the year, as we know with Medicare Advantage, it changes every year, right? Well, if they're in your book of business now, you can go back in October and talk to them about their MA and get back in the door. So really good data, just knowing how to use it, which Isaac did a phenomenal job here, man. Great. This is good stuff, man. Really good stuff.
Awesome.
What do you want to leave us with, my man?
If anybody's got any questions, we're here. You can call us, email us, live chat, text message, Facebook message us. Basically everything but smoke signals and telepathy we have at this point. So any way that you want to communicate, feel free to reach out to us. We can talk about this more. We can strategize together on how we can use this information to affect your business in a positive, growing manner. But again, this is. I'll bring it back to the beginning. It's hard to accurately quantify the value of this product. This is going to separate you from anybody else in the industry. And as we know, there is a ton of opportunity nationwide. There are thousands upon thousands of seniors aging into the market every year. So it's not as if the area is saturated. So this data is only available to other integrity agent partners, and we pride ourselves on writing good business and doing what's in the best interest of the client. As long as we all keep swimming in that same direction and doing what's in the best interest of the client, we're all going to grow and be successful while also serving our most in need, our senior population. So if you're not using the system yet, I really implore you to go ahead and get in here, dive around a little bit, take advantage of this information and use it moving forward, building out your business strategy for growth in the future. Like I said, with this information, we can start today if you want, where you're actively pursuing new leads.
Good stuff, man. Good stuff. Well, Isaac, appreciate it, man. As you can see, at the bottom of the screen, give us a call, 888-622-9122. Isaac, appreciate your time. This is solid training, solid technology. So thank you, everybody, for watching. Give us a call if you have any questions. Appreciate it, Isaac. Thanks, man.
Thanks, everybody. See ya.
Take care, everybody. Thank you.